Welcome to day 3 of the Solution Summit. Today's focus is on some of the core issues affecting our nation's health and solutions that are transformative. Thank you for being here. My name is Janae Wallach. I am a public health consultant, a peace educator, and a member of the Solutions Summit team. Before introducing you to Eleanor LeCain, in the spirit of honoring everyone here and our own well-being, I'd like to offer a way of being truly present in this moment. Follow my lead for a minute. Check in with yourself on a scale from 0 to 10, where 0 is really stressed, 5 is calm, basically neutral, and 10 is, well, bliss. How are you feeling? What number represents you right now? Note that number to yourself or jot it down. Now, shift your attention from your thoughts, your to-do list, meetings after the summit, and focus all your attention on the area around your heart. Place your hand on your heart if that helps you focus here. Feel free to close your eyes. Imagine your breath is flowing in and out of your heart. Gently slow and deepen your breathing. As you get accustomed to this gently slower, deeper breathing rhythm, step into an experience that puts a big smile on your heart. A person, a pet, a place that you deeply appreciate. Continue breathing as if you could breathe through your heart while in this place of appreciation. Now check in again. In this brief time of shifting your attention, your breathing, and your focus, what number on the scale of 0 to 10 are you at now? Where are you on this scale most of the time? The arena of emotional self-regulation provides powerful tools for all of us, regardless of the world we work in, especially when we're striving to take on challenging issues, bring our best self, lead transformation, and maintain our own well-being. Speaking of transformation is a perfect segue. It is a pleasure and an honor to introduce Eleanor LeCain, the Executive Director of the Summit. She created the Solution Summit based on her decades of experience working in government and on campaigns to show practical pathways to solutions to some of our nation's most challenging crises. Eleanor served as Assistant Secretary of State and led strategic planning for the state government of Massachusetts. Her book, Breakthrough Solutions: How to Improve Your Life and Change the World by Building on What Works, has a foreword by the Dalai Lama, in which he acknowledges Eleanor's leadership and commitment in presenting innovative solutions that work and make a powerful difference. Eleanor has served as a top advisor on policy and strategy for many candidates and elected officials, from city council to Secretary of State to Congress to President. Eleanor graduated from Yale College and the University of California Law School at Berkeley. She lives in Washington, D.C. with her husband and her daughter. On a personal note, I have worked with Eleanor for decades. She is amazing at connecting those with solutions to those in positions to implement these solutions, hence the summit. I'm so glad to present her now. Thank you.
Thank you, Janae, and thank all of you for being here today. We are broadcasting live from the U.S. House on Capitol Hill, bringing solutions for broadening prosperity to decision makers at every level and citizens across the country. Our focus today is on health. I'm going to give you first the story behind the summit, and then offer a framing of the root causes of widespread illness and key solutions to improve our health. And then I'll introduce you to the people working on those key solutions. So first, the story behind the summit. As Janae mentioned, I was in charge of strategic planning for the state government of Massachusetts. and learned a lot about all areas of public policy. For years, I continued to search for policies and programs that would improve people's daily lives, create good jobs, have a quality education for all, enable us to breathe clean air and drink clean water, have enough money to pay the bills without struggling, and some to put away for secure retirement. I went on a treasure hunt looking for the best of what's working in America, and I found solutions everywhere. I wrote a book about some of them called Breakthrough Solutions to help them be more visible, and I am honored to have an introduction by the Dalai Lama. I advise candidates and elected officials on solutions oriented policy, working at the local, state, and national level. Last year, I realized the country is in such trouble that helping a handful of candidates is not enough. So I decided to offer what I know to all candidates and all elected officials at every level and all Americans across the country for free. I created this Solution Summit as a platform to share the solutions I've discovered and to give visibility to the people offering them. You know, we live at a time of great peril and great promise. Multiple crises challenge both the United States and the world. It's not an exaggeration to say the survival of our country, our species, and our planet is at stake. If you're anxious or scared, it's understandable, and you have a lot of company. Many people are suffering from climate disasters, financial troubles, illness, and anxiety about our country. The good news is we have solutions to all these problems. In fact, you'll learn about solutions to all these problems at this summit. I would say there's a hidden solutions movement in the United States. Thousands, even millions of Americans are applying their intelligence and creativity every day to make things better. Some of them are visionaries with solutions that could make a big impact. I call them solutionaries. The problem is the people with the solutions often don't have the power to implement them, and the people with the power are often unaware that key solutions exist. So we're bringing together solutionaries with decision makers who have the power to implement their solutions. At this summit, participating will be the chair of the National Governors Association, the head of the National Association of Secretaries of State, members of the New Deal Leaders Network of state and local elected officials, to name a few. Our intention is to encourage the rapid implementation of key solutions to our most pressing problems. We want to offer a beacon of light at a dark time. We want to bring hope that we can solve all our problems because we can. The truth is, this could be a good time. The breakdowns pave the way for breakthroughs to a better America and a better world at a scale that we've needed for a long time. The solutionaries you'll meet here offer big, bold ideas that can help bring systems change, and they'll offer smaller yet impactful actions. We'll answer the question I get all the time: what can I do? We'll provide practical steps that will make a difference. I hope you find one or more ideas for action that you can take. Now, this is the third of 4 programs at the summit. Last week, we addressed climate solutions and also how we can create economic security for all. Next Thursday, we'll address how to strengthen our democracy. Our focus today is why are so many Americans sick and what can we do to create better health for more people? The flow of the day is as follows. I'll give a brief overview of the health problem in the U.S., then some underlying root causes that brought us to our current predicament, and some key solutions that we can implement to promote greater health for more people. Then I'll introduce you to solutionaries who are already working on some of these key solutions. So, what's the problem with health? The problem is that more than half of Americans have chronic illness like heart disease, obesity, diabetes, or cancer. That means, shockingly, that having chronic illness is the norm in the United States. We experienced that on our small summit team as our members got hit with health challenges along the way: COVID, bronchitis, cancer, chronic sleep deprivation. The healthcare system is often overwhelmed with so many patients, leaving doctors and nurses exhausted and sick people waiting a long time before being seen. Treatment is usually given after disease has set in, making it harder for patients to heal. Treatments often focus on drugs and surgery, which in some cases can be life-saving, but in other cases are more invasive and expensive than other treatment possibilities. Much of the discussion about healthcare has focused on accessing the current healthcare system. Access is very important, and there are many other aspects of our healthcare that need attention. So, how did we get into this situation? Here are some of the root causes underlying widespread illness in the United States. The first root cause of widespread illness is a mindset that sees the human body as a machine. It's a mindset that treats organs as separate cogs in a machine, as opposed to an integrated part of a whole living being. Of course, increased specialization has allowed for some incredible advances, like hip replacement, but it has taken us away from a whole system view that family doctors often had and has driven up costs. It's also a mindset that treats people as standalone entities rather than seeing them in the entire context of their lives, which dramatically shapes our health. A second root cause of widespread illness is the drive for profits, which distorts medicine. There is often a push for drugs and surgery which generate high profits. Sometimes drugs and surgery can be life-saving, but sometimes drugs and surgery just treat the symptom and do not heal the body and can create more problems down the road. For example, we know the pharmaceutical companies push opioids to mask pain, then people become addicted to the painkillers. A third and related root cause of widespread illness is the focus on treatment of disease rather than preventive care. An ounce of prevention is worth a pound of cure. Treating disease is much more expensive than preventing it in the first place. A fourth root cause of widespread illness is poor nutrition. Healthy food helps make healthy bodies. Unhealthy food can make unhealthy bodies. Food is one of the most significant factors affecting our health, yet most medical doctors receive no training in nutrition. Sometimes companies aggressively market food products that are unhealthy. A fifth root cause of widespread illness is stress. The majority of people are experiencing serious stress, from financial worries, concerns about violence and safety, work-related stress, and worry about the country, to name a few. We know stress can kill. Heart disease is a major cause of death. The good news is there are key solutions for all these root causes, solutions that can improve our health. Key solution number one, we can shift our mindset. We can treat the person holistically, mind, body, and spirit. We can recognize the body as a whole living system, a whole person, and we can pay attention to the whole environment in which a person lives, including their work, their relationships, and their neighborhood. A second key solution is to focus on wellness and disease prevention. We can prevent illness so fewer people get sick in the first place. We can address the social determinants of health. People are more likely to be healthy if we eat good food, exercise regularly, reduce stress, and interact socially with others. Some evidence shows that the quality of health is more influenced by social determinants than by the medical treatment a person receives. We can also address gender bias and racial bias in the healthcare system. A third key solution is to expand the range of treatments available and covered by insurance. This includes holistic and integrative medicine. A fourth key solution is to help people handle trauma and stress more effectively. We can make mental health treatment much more widely available. We can't possibly cover all these key solutions in one session here today. We can offer some core solutions. And today, what we're going to discuss is the importance of preventive care and the power of food as medicine. We'll discuss mental health and ways of dealing with population-wide trauma. We'll show you a low-cost technique to reduce stress. We'll show you a model of community health care. And we'll talk about how we can heal and transform racism in our healthcare system. The format will be that I'll introduce the solutionary, who will make a brief opening comment. We'll have a conversation for about 10 minutes and then open it to questions and answers. You are welcome to join the conversation with comments in the chat and questions in the question box. Now I'll introduce you to solutionaries already working on these core solutions. Our first session is on preventing and curing disease. Our first solutionary is Ocean Robbins, the CEO of the Food Revolution. He's committed to inspiring and advocating for healthy, ethical, and sustainable food through education about plant-powered foods. His Food Revolution Network has over 700,000 members, including top food leaders of our time. He's going to talk with us about the power of food as medicine. Ocean Robbins, welcome to the Solution Summit.
Thank you so much, Eleanor, and everyone else who is here today. It's great to be with you.
Yeah, it's great to see you. I'm so happy you could join us and lead us off on this great day of health solutions. When I think of health, Ocean, I think of you and your family and your incredible work. Would you like to make a brief opening statement about your work so people know more about it?
Sure. I'm co-founder and CEO of an organization called Food Revolution Network. Our mission is healthy, ethical, sustainable food for all. And I think we start from the foundation of recognizing that we live in a toxic food culture in which systems of growing food and producing food and consuming food are making us sick and are unsustainable for our environment. And we can do better. And the good news is that when we give our bodies the right fuel, we can prevent most of the major chronic illnesses of our times, and we can make a world of difference to feel better and to live longer and to be healthier. And when we talk about solutions, this can be a major solution for the climate crisis, for the biodiversity crisis, for our water and oil and air and soil systems. And it can also help to save a lot of money. In the United States right now, we spend about 19% of our entire gross domestic product. That's all the money we spend on everything on healthcare, which is really disease symptom management. About 90% of that spending is going to treating the symptoms of chronic diseases, things like heart disease and Alzheimer's and cancer and type 2 diabetes and all the dynamics that come with chronic inflammation and excess weight. And the reality is that the vast majority of that can be prevented, if not reversed, with changes to diet and lifestyle. So we can save trillions of dollars by giving our bodies the right fuel, exercising more, smoking less, and having more loving, healthy relationships. All of these things compound and make a world of difference. We can also make a huge difference for the environment. Now, here's a fact that a lot of folks don't know that I think is pretty stunning. The collective weight of all mammals on Earth, about 34% of that is human bodies. About 62% of that is livestock. Maybe that's a little bit more than 62 because the balance is 4% of all biomass mammals on Earth is wild creatures. All the elephants, all the deer, all the lions, all the giraffes, all the caribou, all of the wild animals combined, 4%. Meanwhile, 60+% is livestock. So humans are using vast areas of land and ecological resources to produce the livestock that we feed ourselves. 83% of all agricultural land on Earth is used for livestock production to produce 17% of the world's calories. So it's like a protein factory in reverse. And what it's fueling is chronic disease. Now, the amount of animal products we're consuming, along with the amount of sugar and processed junk and refined flours and fried foods and all the other unhealthy foods, the cumulative impact of this is that it's shortening our lives, it's making us sicker, it's making us feel worse, and it's depleting our environment at a completely unsustainable rate. And the good news is we can turn that around. When we eat real, wholesome, healthy foods that come from the earth, that are produced in sustainable ways, we can also give our bodies the right fuel, and we can feel better and live longer. In the blue zones, the places where people traditionally live the longest and healthiest lives, like Okinawa, Japan, or Icarus in Greece, or the Nicoya Peninsula in Costa Rica, or in Loma Linda, California, or Sardinia in the Mediterranean, we see that people typically live about 10 years longer than we do in the United States. In Okinawa, Japan, they are more than 10 times as likely to reach the age of 100 as Americans are. In Loma Linda, California, they live 8 to 10 years longer than the average American. What's their secret? Well, a big part of it is healthy diet. In all of the blue zones, they eat a predominantly plant-based diet that includes legumes in some form, lots of whole foods, minimal animal products, and look at the benefits, look at the results, look at the life expectancy. That's available to all of us. It's not because they have special water or special genes. They're human bodies living in a human world, eating healthy food. So we have an opportunity, if we're talking about solutions here, to base our diet on the wholesome foods, the legumes and the nuts and seeds and the whole grains, the vegetables, lots and lots of vegetables, the fruits, make those the basis of our diet and reap profound benefits, and also reduce our ecological footprint and be a part of the solution on planet Earth. I think that's pretty awesome. So I started Food Revolution Network to spread the word about this. We now have more than 1 million members all around the world.
Wow.
And we're pretty excited to see what can happen if we change the way the world eats together.
Terrific, Ocean. That's just awesome. And it's so hopeful. You know, when we think of healthcare, we usually think about the Western medicine treatments like drugs and surgery, which of course can be life-saving, but they tend to focus more on treatment after people are sick as opposed to preventing it in the first place. And you've done more than anyone I know, you and your father, to focus on the power of food to keep us healthy and even make us healthy. So, can you talk a little bit more about how important healthy food is for making healthy bodies?
Absolutely. I mean, the thing is that every bite you take is kind of a vote for the health you want as well as the world you want. And we have a food system that is in many ways toxic. You know, we now have tens of thousands of studies published in peer-reviewed medical journals, which make it absolutely overwhelmingly clear that if you eat certain kinds of foods, you're going to get certain kinds of results. Statistically, now you're the only you on the planet. Every one of us is unique, and all of our bodies are unique. So just because studies show that something is good for most people most of the time doesn't mean it's good for all people all the time, or that it's good for you right now. But what we know is that there's data, and the data tells us that statistically, eating diets that are high in sugar, high in processed foods, high in added chemicals, high in animal products, especially from factory farms, is linked with higher rates of obesity. Now, 2/3 of our population is overweight or obese. Higher rates of diabetes, especially type 2 diabetes. Higher rates of Alzheimer's. We now know that over half of the people over age 85 in the United States are going to die with Alzheimer's or another form of dementia. And higher rates of cancer. But all of this can be turned around. When you eat a diet based on whole, natural, unprocessed foods with lots of fruits and vegetables and lots of plant foods and all their phytonutrients, you can make a world of difference. And we have study after study showing us. For example, in the Chicago Health and Aging Project study, researchers at Rush University found that when people ate an average of, actually not that much, but the most green vegetables daily, equivalent to a couple of ounces, a few ounces of green vegetables daily, leafy greens specifically, they had 11 more years of healthy brain function. 11 more years before, if they were going to get Alzheimer's, it set in. If you ever have had anybody in your life who's had Alzheimer's, you know what you would give to give them 11 more years of having their mind back. I mean, that's priceless. Just from eating a relatively modest amount of greens daily. Then we've got a study from researchers at the University of Perth in Western Australia, studied 6,000 women over the course of a number of years, about 6 years, and they tracked, half of them had previously had breast cancer, half had not. And they tracked all aspects of their diet and lifestyle and looked at their outcomes. And then they crunched the numbers. And what they ended up finding was the biggest factor in whether or not they were going to get breast cancer again or die of breast cancer over the course of the study was mushrooms. When those women ate mushrooms daily, the average equivalent to about a button mushroom a day, they had a 64% drop in risk of dying of breast cancer. When those same women also drank green tea daily, their drop was 89%. So what could mushrooms and green tea and greens do for us in terms of reducing Alzheimer's, in terms of reducing cancer? A lot, apparently. And that's just scratching the surface. What happens when you also consume lots of legumes, which is one of the staples? The average person in blue zones around the world is eating about a cup of beans a day. Well, this is huge, folks, because if we can eat more legumes and more greens and more mushrooms and drink more green tea, maybe we don't have to die of cancer and Alzheimer's. Maybe our cardiovascular health can improve. We have research, credible, solid research showing that up to 90% of cardiovascular disease symptoms can be reversed with healthy diet and lifestyle, not to mention prevented. Heart disease is the #1 cause of death on the planet by far. And maybe most of those deaths never needed to happen. I find this exhilarating.
Yeah, and so do I, Ocean. And I'm reminded as you're talking, I've known for a long time good food can help us be healthy. But it wasn't until I read Dr. Dean Ornish's amazing book called Undo It, about how simple lifestyle changes can reverse most chronic diseases. So even if you've already got a problem like cancer or diabetes or heart disease, you can still reverse that by healthy life choices, as you were just saying. I think that's just incredible.
It really is, and a lot of people think it's normal to feel like crap and to need more and more drugs and surgeries as we go through life. And the wonderful news is that it may be normal, but it doesn't have to be your fate. Now, of course, we're all going to die, right? Like life is a terminal diagnosis and everybody's going to die of something eventually. So the point isn't to have some protection from all suffering or all disease. The point is to do the best we can to have the most optimal quality of life and longevity that we can, right? And so some people are like, oh my God, so-and-so did everything right and they got cancer. Yeah, it happens. You tilt the odds in your favor. You're not guaranteeing you won't ever get anything. We live in a toxic environment. We all have air and water pollution. We all have genetics that have been impacted by ancestors that ate all kinds of things and lived under all kinds of stresses. Nobody's going to be perfect and live the pristine, perfect life forever and ever. But let's do the best we can. Let's love our lives and let's love our bodies and let's bring as much consciousness as we can to our relationship with food so that the act of nourishing our bodies becomes an expression of love and care and compassion and kindness and consciousness. So let's learn from the studies, let's learn from the research, and let's be informed by them. And if you're struggling with any chronic condition right now, the odds are there are diet and lifestyle choices you could make that might help. And I think that's
Right.
hopeful and heartening. And the medical system doesn't focus there very much. The average doctor gets about 19 hours of nutritional education in all their years of medical school. And most of those are focused on specific symptoms of specific deficiencies of nutrients, not on what dietary patterns help patients or how to help people be healthy. And this is a tragedy because, you know, it's kind of like a firefighter not knowing about water, for a doctor to not know about food. Food is the absolute foundation of health. But the good news is we can change that. We can build systems and policies and enact practices in our own lives to become learners and leaders rather than followers. In a toxic food culture, you can't afford to just go with the status quo, to just do what your doctor says. You know, your doctor may have a lot of insight about certain things, but nutrition probably isn't one of them. So it's time to get informed ourselves.
Right, exactly. And of course, we want to work on the system change. Even when I was in college, I was trying to get, in fact, I got a seminar on nutrition for Yale medical students, but it's not fully integrated at the level it needs to be for medical professionals, doctors, nurses, and so forth. It really is such a powerful tool for our health. And as we're working for that system change, of course, we can educate ourselves. You are the go-to place with the food revolution. That's where I learn a lot myself. I send people to you. And, you know, you've got such great examples in your own family about the impact of food, both in a good way and in a bad way. I mean, you're the grandson of the man who founded Baskin Robbins ice cream, who ate lots of sugar and cream. And your father had a major health challenge and then really focused on healthy eating and did incredible strength and recovery. Why don't you just talk very briefly about your own experience in your family about the impact of food and health?
Sure. Well, you just covered some of the high levels of it, but yeah, my grandpa founded an ice cream company that was pretty successful, and you know, his business partner and brother-in-law was Bert Baskin, and my grandpa lost Bert, one of his dear friends as well, when my dad's uncle was 54 years old. My dad's uncle Bert died of heart disease. You know, he was one of the most successful entrepreneurs in American history. He had a family he loved, but he didn't have his health. And he ended up leaving his wife a widow and his kids fatherless. I never even knew my dad's Uncle Bert because he was gone before I was born. Just know about him from stories. And then my grandpa in his late 60s was on a similar path. He was facing serious weight issues and diabetes and heart disease. And his doctors told him he needed to take certain medications that had major side effects for the rest of his life. And then he didn't have long to live unless he made some big changes. But my dad had followed a different path. My dad had walked away from the family ice cream fortune and any access to the family wealth in his teen years, and wound up moving with my mom to a little island off the coast of Canada, where they built a one-room log cabin, grew most of their own food, and practiced yoga and meditation for several hours a day, and named their kid Ocean. And then went on to become a best-selling author, writing about food and health, with Diet for New America coming out in 1987. So then in the later 80s, my grandpa was practically on death's door, and his doctor gives him a copy of my dad's book, Diet for New America, and tells him if he wants to get better, he should read it and follow its advice. Amazingly enough, Grandpa Irv read the book and he made big changes, and he gave up sugar. He cut way down on animal products. He started eating a lot more whole foods and fruits and vegetables, eating oatmeal for breakfast every morning. And he even gave up ice cream, and he got results. He lost a bunch of weight. He reversed his diabetes, reversed his heart disease, felt a whole lot better. His favorite part was that his golf game improved 7 strokes. My favorite part was that he lived 19 more healthy years. And that for the first time in my life, I thought he seemed happy. It's like he had a new lease on life. He had another chance, and he was going to take advantage of it. So we've really seen in our family what happens when we follow the standard American diet, as my dad's uncle did, as my grandpa did. And they spread the word about ice cream and sold a lot of ice cream. But we've also seen what can happen when we make a change. And I think that's so extraordinarily powerful because, you know, a lot of us struggle to make changes. My grandpa Irv was one stubborn cookie. If anyone ever had an investment in thinking there's no connection between diet and health, it was him. But he made changes and he got results, and we've seen what can happen when we do that. And at Food Revolution Network, we get to hear stories almost every day from people whose lives have been transformed by healthy eating, and they have their health back and their lives back, like my grandpa got his health and life back. And I feel so blessed to be a part of helping people have not just hope but health. Again, there's the old saying that a person with their health has 1,000 dreams. A person without it has just one dream, which is to get it back, of course. And so anyone who's ever been in real pain knows what that's like. And, to help people get their dreams back and their health back is precious to me. And it means we can do what we were born to do, and we can make a bigger difference, whether it's wanting to play with our grandkids or volunteer or change policy, in Washington, D.C. I think we all have an opportunity to be a part of the solution and to make a contribution. And it's so much easier to do that when you have a clear mind, when you have vibrancy in your body, when your energy is intact. And so I want to help people have that. And it all starts with food.
That's a really powerful story, Ocean. Thank you so much for sharing that. I'd like to invite into our conversation now a woman who's done some incredible research, Tera Fazzino. She's a professor in the psychology department at the University of Kansas, and she's the lead author of a new study on how tobacco companies engineered food to be addictive. Dr. Tera Fazzino, welcome to the Solution Summit.
Hi, thank you so much for having me today.
Yeah, well, thank you for your great research. And, I was stunned when I read your study. I didn't realize that the big tobacco companies had bought these big food companies and then engineered the food to be addictive in similar ways as they had done making cigarettes more addictive. Could you tell us just kind of the highlights? What did you find about this in your study?
Absolutely. So to start with, yes, it is not a known fact to most people in the general population, nor most scientists, that the tobacco companies were even involved in our food industry in a meaningful and substantive way. So this is something that, even caught me by surprise when I started this area of work. And so basically what we did was we looked into previously secret industry documents that are now available in a public repository. And we were able to look at and identify all the foods and the companies that U.S. tobacco companies owned. And so specifically Philip Morris and R.J. Reynolds, who are basically the biggest tobacco corporations in the U.S., bought into major U.S. food companies during the 80s. So big names like Kraft, Nabisco, Oscar Mayer were all under their ownership. And so what we were able to do is to use data from the U.S. Department of Agriculture that is representative of our food supply at various points in time. And we were actually able to analyze and look at whether tobacco companies' food products through the food companies were more likely to be formulated to be hyper palatable relative to the same types of foods that were available and sold from competitor companies that did not have a parent tobacco company ownership. And so the term hyperpalatable is probably new to most folks as well, so I can briefly describe that. And so hyperpalatable foods have combinations of palatability inducing nutrients that occur at thresholds together that typically don't occur in nature. So for example, elevated fat and sodium, elevated fat and sugar, carbohydrates and sodium. And so what these do together is they create an exaggerated experience of palatability and like a rewarding experience when we consume these types of foods. And underlying that, they actually have an exaggerated effect on our brain reward neurocircuitry as well, which makes them highly rewarding to consume and difficult to stop eating. And this is the same brain reward neurocircuitry that is activated by psychoactive drugs, including alcohol and nicotine. So these foods So those are hyperpalatable foods. Many of them are also highly processed and contain other sort of potentially problematic things as well. But basically, yes. So we found that when tobacco companies basically dominated our food supply for over 20 years, during the key period of the late 1980s to early 2000s, the tobacco company owned foods were more likely to be hyperpalatable, with elevated fat and sodium, which was a lot of like our meal-based items, frozen entrees, hot dogs, sausages, those types of things, as well as carbohydrates and sodium, which are a lot of our snacks and crackers, things like that.
Yeah, well, we had the standard American diet, as Ocean referred to, otherwise known as SAD, even before the tobacco companies took over the food companies. But this idea of engineering the food products so they're addictive to people, to young people, to all of us. But you talked in your research about the Lunchables and how that's what we gave to the children growing up, going to school. It's like, oh my God, when you see like there's nothing healthy about this. This is not good. It's what OSHA was talking about, our toxic food culture that we're in. And I'm going to ask both of you to answer this same question. I'll start with you, Dr. Fazzino. Based on your findings, what recommendations do you have for government leaders on action that we need to take to help Americans stay healthy or become healthy?
Well, I very much appreciate this question. There are some really important things that need to happen and that our legislatures can initiate as a process. So first of all, given that we have evidence to indicate that the tobacco companies were involved in basically shifting the food system in the U.S. towards greater hyperpalatability. We know that over 70% of the U.S. Branded foods sold are hyperpalatable, and so we really just exist in an absolutely saturated food environment. And so what that means is that we are faced with hyperpalatable foods at every single turn, anywhere we go. Those are primarily what's available, and they're often the most inexpensive as well. So but the good news is that like there is a precedent that has been set with how to address addictive substances, if you will, that the tobacco companies have put into our environment. So we know in the 50s that U.S. tobacco companies maximized the degree to which their cigarettes were addictive. And they used a number of key strategies as well as really aggressive marketing and sales approaches to sell these addictive products. And so given that, and given that we, now there's evidence to indicate that that hyperpalatable foods, we're disproportionately sold in our food system by the tobacco companies, we can apply the same approach here. So first of all, what I would recommend is that we need federal and state level regulation of these products to protect public health. So what that could look like is that we treat hyperpalatable foods in the same way that we treat other legally available substances, such as cigarettes. So, hyperpalatable foods could be sold, but in a regulated way. So they would be behind the counter in a grocery store, or somewhere in a regulated space. And food products that are not hyperpalatable. And I should mention that we have a standardized and quantitative definition. So it would be very easy to compare the nutrients and find out if each specific food meets those criteria or not. And so foods that would not be hyperpalatable should be allowed to be sold, sort of in a freely, the open space in the store. And so that would largely help the population on a whole, because we wouldn't have to be navigating stores that are just saturated with these foods and having to go kind of out of our way to try to avoid them and try to make healthy choices, when really the foods that are available as fresh and whole are the minority in our stores and are more expensive.
That's a great idea. I had never even thought about, treating these food products like cigarettes because they're addictive. I'd like to bring Ocean back, as Ocean, one of the last comments you made was about speaking to our representatives in Washington. And I'm curious, with all that you know about food helping keep us healthy or even helping to cure and reverse some chronic illness, what do you think are the most important actions for leaders in government to take to help American people be healthy?
So one of the big things we can do is I'm a big supporter of produce prescriptions. This is where Medicare and the big insurance companies can actually pay for fruits and vegetables for patients with certain lifestyle-related conditions. And their researchers at Tufts University have studied this, and they have found that it is a cost-effective intervention in terms of reversing cardiovascular disease and type 2 diabetes and certain other chronic conditions. And it also has the benefit that it helps make it more affordable for folks to access these healthy foods. But the other thing is that even while it may be effective as certain drugs or surgery treatments that are currently being paid for those specific conditions, it doesn't have any bad side effects. In fact, eating more fruits and vegetables helps with everything. So this is something that I think should be required for insurance companies and Medicare to, and I think government could play a role in pushing that forward. Number two is what's called the Double Up Bucks program in the SNAP funds. So food stamps, as we call them, or SNAP dollars, Supplemental Nutrition Assistance Program, are a critical part of the nutritional needs for about 80 million Americans. And if we were to double the value of SNAP dollars when used to purchase fruits and vegetables, then again, we would be uplifting the health of some of the poorest folks who can least afford to get sick. Right now, statistically, the poorer you are, the more likely you are to suffer and die from chronic disease and to depend for the majority of your calories on hyper-processed foods and sugars and animal products. If we can support getting more fruits and vegetables into these communities, then we can uplift the health of the entire population. And this is the most, I think, strategic intervention point for public health. So those are two of the things that I'm enthusiastic about. We could also, we provide tens of billions of dollars in subsidies to commodities crops. Now, I'm all about helping our farmers and farm workers. They work really hard to bring us our food, and we should love them and thank them and make their lives easier. However, right now, in effect, we are creating a marketplace distortion because we are driving down the price of things like high fructose corn syrup and white flour and highly processed foods at the expense of, from a marketplace level, fruits and vegetables and nuts and seeds and other so-called specialty crops, which we're hearing now more and more should be the basis of our calories. Twinkies has 14 subsidized ingredients in it. Broccoli has none. This makes no sense. If we're going to subsidize anything, shouldn't we subsidize the healthy foods that will help us be healthy and live longer and be more well? I think so. So I'm really interested in how we can shift policy to stop tilting the playing field in the direction of factory farm meat. The only reason that factory farms make any sense economically is because the feedstuffs for livestock are primarily corn and soy that are genetically engineered on mass subsidized farmlands. If we were to have, if they had to pay for full price for these feedstuffs, factory farms wouldn't make any sense economically. So I think that we need to shift it so we're having real feedback loops about cost and benefit. If we did that, I think capitalism is a wonderful system when it's fair and makes sense. But when you start distorting it and having certain established interests getting special deals, meanwhile, the vast majority of farmers and farm workers are struggling just to survive, and consumers have to pay extra for eating healthy food, it's like you're getting fined for wearing your seatbelt. So I think we could shift policy to lean into supporting the foods that are best for us, bringing down the price, creating the purchasing power opportunity for the poorer communities to be able to buy these foods. And in the process, we can transform the health of our nation.
Yeah, that's terrific, Ocean. We need to focus on what we want, which is we want healthy people. It's fresh fruits and vegetables and whole grains that you're talking about. That's it. These food products really, most of them have no positive food value to our bodies, and there's a lot of negative things, as we were just learning, all the salt, all the sugar. So why in heaven's name are we subsidizing that? At a minimum, let's remove the subsidies to the bad stuff and see if we can encourage people to go in a more positive, healthy way with the food. I
Yeah,
love
absolutely.
those ideas. So we're now at our question and answer segment of the session. And please put your questions in the question box. We have some already. While the questions are coming in, invite Dr. Susan Abu Khair to the stage. Dr. Abu Khair is a medical doctor and a professor at Harvard Medical School and will be our expert commentator throughout the program on health today. Dr. Abu Khair, would you like to ask the first question?
Yes, and thank you for having me. I'm delighted to be here, and I want to thank both of the speakers for your incredibly inspiring work. It's really amazing to reflect on the foundational power of food, both to help us and to heal us, as well as the threat to harm us. So it's really amazing work. My first question I want to ask you, Ocean, I have a question for both of you if there's time. In addition to the really important policy issues that you mentioned and the subsidies, aligning subsidies with what makes sense, I'm curious, what would it take to get the practice of healthy eating into everyday lives? Is it enough to provide fruits, vegetables, and healthy foods at a reasonable cost? Or do people really need to learn how to eat and how to cook and really be retrained in our food habits?
I think we need to address this on every level. Like life works in biodiversity, and for every 1,000 seeds that a tree makes, one might make it. So you never know what's going to pop. I'm approaching this from every possible angle because I see what's at stake, and I want life to go on, and I want us to have a better way together. So as individuals, absolutely, we need to cook. We need to reclaim our health lives. We need to shop from lists instead of being at the whim of where things are laid out in the grocery store and being succumbing to impulse purchases. We need to learn the skills and the tools for self-nourishment in ways that are truly healthy. Cook in quantity, learn to share healthy food with loved ones, make friends with healthy recipes. These are all wonderful things. And there are so many steps we can take to base our diet around real, wholesome, healthy foods. At the same time, of course, we need policies. It's not enough to just say, okay, it's up to every person to solve the world, save the world, right? And the reality is everyone's going to do ultimately what's in their own best interests. And I think companies are the same. I saw a comment earlier saying, well, companies won't just give up their profits. No company is going to be like, yeah, we're going to go under and go bankrupt because we want to save the world, right? That would be against their DNA any more than you or I would say, I'm going to kill myself because I'm a consumer and I'm destroying the planet. No, we want to live. We want to live in a good way. Everyone should want that, right? The question is, how do we collectively design systems that make it easier for self-interest to be aligned with and enlightened by collective interest? And at the company level, we need government policies, quite frankly, that make companies have to do the right thing. And as voters, we obviously need to speak out and organize so that our politicians have some incentive to do the right thing. Because just like a politician's interested first and foremost in staying in office, right? Which means that's their bottom line, if you will. And they've got a calculus of what their donors do and what the media does and what their voters think and all of that, right? It's just self-interest, right? Companies want to stay in business and they want to make profits. Well, we as consumers have some power. Yes, as voters, yes, as advocates and as consumers. And when a company says, oh my gosh, if we clear cut the rainforest and buy chocolate from children that are enslaved and that gets out and people learn about it, then it's bad for business. So we better try to make some changes. And that's sometimes the incentive for companies. And I wish everyone was just, oh my gosh, we want to save the world. But, Burger King didn't start serving a veggie burger because they suddenly said, oh my God, we're destroying the rainforests and torturing animals and we want to help not give people heart attacks. No, they did it because there was money to be made. So how do we create systems where companies can make healthy profits from healthy food, right? And some of that is consumer level, creating marketplace demand. Some of that is at a policy level, creating the systems that nudge companies in the right direction. And unfortunately, a lot of our policymakers are bought off by the status quo because that's where it's funding them, right? So I think we've got our work cut out for us, but I also believe we can absolutely design a better system. right? That's what humans do, right? Throughout our history, our ancestors have innovated, have evolved in response to real circumstance. Well, we're now facing a real circumstance where our collective health is at stake, and perhaps the survival of our planet is at stake. So are we going to evolve? I think we can, but it's going to take a reinvention of policies and practices and personal consumer choices to be part of that evolutionary wave.
That's a great insight there, Ocean. And I would say, what you're pointing to is that the country that we have, the world that we have, is a result of choices that we make, both individually and collectively. And we can change those choices as individuals and as a society. And now that we know what we know about the connection of food and health, it'd be important to make both the system shift and the personal shift to go with the fresh fruits, vegetables, whole grains. That's terrific. And part of the issue is around education. A lot of people are not aware of it. There's actually a lot of confusion and misinformation, in part because of the money that's spent by the big food companies to promote food products. But so we have a question in here about how do we change at the education level, both in terms of the content of what's being taught in schools and also the food that is being offered in schools? I know Michelle Obama, when she was first lady, tried to improve the quality of food in schools. But do you have any thoughts about change at the educational level? Ocean?
Yeah, sure, I can answer that one. I think that absolutely, that's another part of the one of the spots we need to focus on is, number one, the food that we serve in our schools, right? School meal programs are traditionally not the healthiest and have actually been a space where the USDA is sort of disposing of excessive commodities, crops, as a way of propping up certain farms and farming industries. And so a lot of refuse, if you will, from the agricultural industry finds its way into our schools. School meal programs are the primary source or an essential source of calories for tens of millions of kids. And in many cases, they're nutritionally vapid. So we've got to focus on teaching our kids early on about the value of self-care and healthy living and feeding them accordingly. You can't just do one or the other, by the way. If kids just get healthier food, they may not eat it if they don't know why, if they don't have fun. And gardening is one of the most critical ways that children can learn about healthy eating, because the studies show that when kids grow vegetables, they eat more vegetables and they have more sense of connection and enjoyment of the experience. So school gardens are a huge part of the solution, healthier school lunches and education. But by the way, that education cannot be co-opted by industry. We've got lots and lots of processed food companies that would love to provide educational curriculum materials for free to our schools, and they have done so. And schools that are not adequately funded wind up depending on the not so healthy foods that are available to them for the cheapest possible price. And they wind up depending on educational resources that may not be unbiased. Even if it comes from government sources, it may be tainted by industries that are out to make a profit. So we've got to clean that up so that kids are getting objective, scientifically grounded, research-backed education presented in a friendly, user-friendly way that makes it fun for them to learn about healthy eating. And then we've got to provide healthy food to them. And if we can start that really early, before people have gotten completely caught up in the toxic food norms of our society today, we can make a world of difference. We can set them up on a path towards more clarity and more empowerment and more vibrant health. And by the way, we should be teaching cooking in school too. I tell you, a lot of the stuff that's taught in school is far less important than knowing how to feed yourself. And it used to be, I think some women taught, was it home economics, courses, and nowadays that isn't even so much a part of things. But we should all be learning, regardless of gender, about how to feed ourselves, right? This is a fundamental life skill, especially in a toxic food culture. So to me, these are all steps we could take that really could prepare future generations to be so much healthier and happier.
Yeah, that's so true. And you've answered another question we've got here is, about how food deserts play into chronic illness in certain communities because people do not have access to healthy food, or it's hard to access healthy food there, and ideas on how lower income people can access more nutritious food. Part of what you're talking about, if we could have it start with the schools, like have healthy meals in schools, right?
That's a huge part of it for a lot of people. But some of the other solutions, community gardens, obviously I mentioned school gardens. And then I think that the double up bucks program, doubling the value of fruits and vegetables with SNAP dollars, could make a big difference on a few levels. Yes, it studies show that when that happens, people buy more fruits and vegetables, and they eat more fruits and vegetables, and they're healthier because of it. But also it increases that purchasing power, which also helps seed fruits and vegetables in those communities that are highest in SNAP recipients, right? So where you've got 7-Elevens and grocery stores that are actually liquor stores that may have like one apple and one orange, right, on display, and mostly they're serving processed junk and chips and highly processed foods. Well, if their consumers get double value for fruits and vegetables, they're more likely to buy them, which makes those stores more likely to stock them. So you start to see a change in what's in the marketplace as a result of consumer behavior, which is empowered starting with government behavior. So I think these are all steps we can take. Obviously, no one of them alone is enough, but they all add up and they all matter. So does eliminating implicit bias in medicine, and some doctors I know say they're more likely to talk about nutrition with white patients than patients of color. Why? Because they are carrying this bias that white people are more likely to take action based on that information. And that's just got to change, right? Like everyone deserves the truth, and doctors need to be informed, obviously, as well, so they can bring that truth forward. So there are so many ways that bias and obviously racism and injustice shows up, and people who are desperate are less likely to think about the long term and more likely to be in survival mode. So obviously it all comes back to, if we really want to solve food deserts and uplift the health of low-income communities, we've got to change the status of those low-income communities so people have more power and more opportunity to make choices that are long-term rather than just how to get through the day, right? And that comes back to living wages and so many other factors that are probably beyond the scope of our discussion today. But it all matters, right? And step by step, we can absolutely uplift the health of populations and communities, and we all are the better for it when we do that. It's not just about charity for some communities. Like the entire society is better and healthier when we stop spending so much money on disease symptom management. Those costs are borne by everybody. Every insurance buyer has to pay more because of folks who are desperate and suffering. And the uninsured populations end up going in for emergency medical care, for emergency surgeries that maybe didn't have to happen in the first place. And then that winds up being a cost that the hospitals bear, which in turn means they're charging more for everybody. So there's no way around it, folks. Like, we're all paying the price for sickness as a society. We're all affected, which means we all have a stake in doing better.
Right. We all have a stake in doing better. Well said. Ocean Robbins, thank you so much for being with us today. And also Tera Fazzino from the University of Kansas. We really appreciate you carrying this wonderful first session on the connection of food and health. And Dr. Abu-Khair, inviting you to stay on. We'll be hearing from you throughout the program today. Thank you. We're moving on to our next segment, is keeping communities healthy. We're going to begin this segment with Dr. James Gordon, who's an expert on healing population-wide trauma, which is, I think, what we're dealing with in the United States, but even more so now in the Ukraine, where Dr. Gordon is currently in the Ukraine. He was going to be with us live today, but he asked 2 days ago that I record him because he was moving to a remote part of the country and was uncertain they would have internet access there. So this is the interview with Dr. James Gordon. Our next speaker is Dr. James Gordon, medical doctor, founder and CEO of the Center for Mind-Body Medicine, the world's largest, most effective evidence-based program for healing population-wide trauma. He's a Harvard-educated psychiatrist and a pioneer of mind-body medicine and integrative medicine. He is a clinical professor at Georgetown Medical School and was the chair of the White House Commission on Complementary and Alternative Medicine Policy under both Presidents Clinton and George W. Bush. He's the author most recently of Transforming Trauma, The Path to Hope and Healing, which we'll be talking about today. Dr. James Gordon, welcome to the Solution Summit.
Thank you. It's nice to be with you, even though I'm with you at a distance.
Yes, exactly. Well, you are the world's leading expert in healing population-wide trauma. And right now, as we're talking, you are in Ukraine, helping Ukrainians heal from the terrible trauma of the war from the Russian invasion. What are you doing to help the people of Ukraine heal from this incredibly tough trauma?
Well, we're doing what we've been doing for 25 years, is that we're training local people, both clinicians, psychiatrists, psychologists, psychotherapists, but also teachers, leaders of women's groups, and other people who are community activists. We're teaching them our model of self-awareness, self-care, and mutual help, teaching them how to use 16 different self-care techniques, training them comprehensively. And right now, we're here providing some of the follow-up mentorship and supervision. We're working currently with 138 people in 11 oblasts, that's regions, 11 regions of Ukraine. And this is what we hope will be the beginning of a much larger program that is being sponsored by PACT, which is a major U.S. aid grantee. So we're working with PACT to train these people. They're bringing this public health approach out to their communities right now. And we're here as they come to us with questions and as we deepen their understanding of this method and work with them to continue to use it more widely.
Fantastic. Well, I love this public health approach to handling trauma because there's so many people traumatized in the U.S. and around the world. You know, one-on-one is going to take a lot of work, and we just don't have enough trained psychologists to be able to help enough people. So you are an acclaimed mind-body medicine pioneer. You presented the first evidence-based program to reverse both the psychological and biological damage caused by trauma in your groundbreaking book called Transforming Trauma, The Path to Hope and Healing. In your book, you give us a blueprint for your trauma healing work that, as you say, you've been doing it for 25 years, which includes practical tools to alleviate stress, anxiety, and sleeplessness. Can you share one tip for people who are struggling with these challenges?
Sure. And I think first I want to emphasize what you said about a public health approach. Trauma is a part of human life. This doesn't mean we have a pathological condition. When any of us is stressed enough, when we experience significant enough trauma, we're going to experience some symptoms and we're going to have some difficulty dealing with it. So it's important that this understanding, that this be part of our whole educational system and that we not think that people have a disorder necessarily that they have to go see a psychiatrist or a psychologist for. This needs to be part of the fabric of everyday life. So for problems like anxiety and sleeplessness or sort of generalized worry about what's happening around us and hypervigilance and difficulty concentrating, the most important things, and I talk about this in detail in Transforming Trauma, are bringing ourselves first back into biological and psychological balance. So we teach, and I teach techniques like slow, deep breathing. Very simple. You don't have to have an advanced degree to teach it or learn it. You just breathe, and that is the antidote to the fight or flight response, which persists long after it's necessary when we're traumatized. We teach active physical techniques that help break up the freeze response. That is, when we're overwhelmed, we kind of shut down and we withdraw, and we need to move our bodies. Physical exercise is always good, but free movement, shaking and dancing is really important. Other thing that's crucial, again, that I emphasize in Transforming Trauma, is it's good to have somebody to talk to about what's going on. Because when we're overwhelmed, we often feel like we're living with whatever we have by ourselves. That just happened during the pandemic. People, even though everybody in the United States and around the world knew that everybody else was affected, there still was that sense of being alone. So it's really useful to have somebody or bodies to talk to, which is about what's going on, which is why finally, one of the things we think about, the anxiety, the worries that keep us up, take care of business. Don't keep putting, and one of the tendencies we have is because they're causing us anxiety, whatever those concerns are, we tend to put off doing anything about them, which only increases the anxiety. So if we can bring ourselves back into balance, we can use our minds, use our imagination better, and we can take care of the business we have to.
That's terrific. Well, you mentioned how, widespread trauma is now, and clearly in Ukraine, they've got a war going on, but here in the United States, it seems like the vast majority of people are traumatized by COVID, by chronic illness, by financial stress, by the polarization politically that's happening, and so much more. How could you use your public health approach to healing trauma to help the people in the United States?
Well, I think the first thing is that people have to understand that they can deal same techniques I just mentioned, like slow, deep breathing, like moving the body, and then use the other imaginative techniques that I describe in transforming trauma, like using the imagination to imagine solutions. Also sharing with other people. I think one of the crucial things that we need in life in the United States is that sense of belonging to a group, of having a group with which you can share whatever is going on with you. And ideally, not just a group of people who agree with you, but a group. One of the ways we set up our groups is we have people who come from very different places when we do a training program. Now that one of the blessings, I suppose, of the pandemic is we brought all our work online so we can have Orthodox rabbi from Israel, and this was in one of my groups, on the same small group with 3 covered women from Iran and a Native American healer and a psychiatrist from Los Angeles and people from Africa, and coming together and discovering the similarities as well as learning to appreciate the differences. One of the terrible things, as you're referring to, and you're down at Congress, which is one of the places where this plays out, is how people aren't listening to each other. And they're just kind of repeating the same things over and over again, instead of really looking at what the possibilities are. I'm doing some work with members of Congress after January 6th. And it was very helpful for them to be able to speak truly about what was going on inside them and to share with one another the difficulties they had and also some of the differences and to learn from each other. So I think that bringing in this sense of creating safe places where people can not only learn the kinds of self-care techniques that I teach and that we teach at the Center for Mind-Body Medicine, but where they can share their experience with each other. I think this would be very, very helpful.
That's terrific. Well, you mentioned working with helping the members of Congress to heal the trauma from the January 6th invasion, which is terrific. Thank you for doing that. And we're broadcasting from the U.S. House for this Solutions Summit. I'm wondering, what are the top recommendations you have for our government leaders on what government action is needed to help improve the health of people in the United States?
I'm glad you're asking the question. I hope people will listen. I think, first of all, we have to bring this kind of approach that I'm talk about in transforming kids. We've worked in a number of American schools, particularly after school systems, after mass shootings, for example, in Parkland or more. Well, and where kids can come together and learn how to deal with their stress. An opportunity to share in an unforced way. We're not saying you have to talk about this, but where they can come together in a small group where they're not being graded, they're not being judged, and share with each other what's happening. That's enormously powerful and enormously healing. So I think that's the first thing. Second of all, we have to make our healthcare system free for everybody. I mean, we've been saying this, people like me have been saying this for, I don't know, 60 years or so. Healthcare is a right, not a privilege, but everybody should have access to it. And there should be an emphasis in all of our healthcare in teaching self-care. And so the physicians and nurses and mental health professionals, we really need to be teachers as well as treaters. And we need to make this a recognized part and a central part of our care people, no matter what they're coming for. And we need to have the time for it. 10-minute visits are not going to do it. We need to create the time for it, and we need to pay people for their time. Right now, the healthcare system is still skewed in favor of you get 20 times, 30 times as much for a procedure as you do for actually talking to people. And we need to change that. Because the problems we have are chronic. They're related to stress, to how we live and how we live with each other. And there's no magic bullet. And the answers really come, all of us learning how to better take care of ourselves and finding social support from others, and certainly from our healthcare professionals.
Absolutely. That's so right on. And I might add something you mentioned earlier, which is to be educating people, even in the schools, about how we can deal with stress and develop those skills early on in life. You know, we got these, you mentioned the school shootings happening, which are horrendous. But unfortunately, our young people have a lot of stress to deal with. So let's give them the tools to deal with it. And, you know, I'm really curious. You served as the chair of the White House Commission on Complementary and Alternative Medicine Policy. I'm wondering, how does your knowledge of mind-body medicine inform your work on healing trauma?
Well, there are two basic aspects to mind-body medicine. The first is the biological fact that all of our thoughts and feelings, all of our relationships with each other, every organ and every cell in our body, and vice versa. What's going on in our bodies affects our mind. So that's well-known physiological fact that we've refined over the last 150 years. The second piece is that what we're discovering, or actually rediscovering, because indigenous people knew, have the capacity to enter into that continual mind-body conversation in a way that's positive. So that's what all our trauma healing work is based on, is the understanding that every part of us is connected with every other part, and we can use our minds, we can use our bodies, our imagination to enter into that continual conversation in a positive way. So that's, for me, that's essential. That's the essential part of the trauma healing work that we do. And I want to add that commission that I chaired, that the people who listened most closely, or the organizations that listened most closely, were the Department of Defense and the VA. And they've actually, I've worked a great deal, particularly in recent years with the Veterans Administration System, where they don't have those same financial constraints. They are much more interested, at least many of the divisions we've worked with, in bringing these tools in for healing trauma and for dealing with chronic illness as well. So that's a very satisfying consequence. Now we need to bring it into the whole civilian healthcare system as well.
Well, I think that's so right. And, you know, that Veterans Administration, I mean, I've talked to people, they believe that could actually be a model for national health care, like build out the Veterans Administration. And part of it is, now I'm learning, is this wonderful contribution that you've helped to make that better for our veterans. And finally, I know our listeners and participants are going to want to learn more about your work. How can they learn more what you're doing and connect with you?
Great. Well, the Center for Mind-Body Medicine, which I founded in 1991, and 32 years later, we're growing and everywhere right now in Ukraine. Please look at our website, cmbm.org. charliemary.bettymary.org. Lots of information about our programs. There are free demonstrations of many of the techniques that I describe in Transforming Trauma that are there on the website. People can subscribe to our newsletter. And if you want to be trained, and as I said, we've trained about, I didn't say how many, we've trained about 8,000 people around the world. And you don't have to be a physician or a psychologist or clinical social worker. We train people who want to learn these tools and techniques for themselves and share it in their communities. So we have trainings that are coming up. We have online trainings that are available. So please take a look, cmbm.org. And you can also, if you want to see what we're doing and learn 20 different self-care techniques and look at the research and hear some stories that I hope are inspiring, you can read my book, Transforming Trauma, The Path to Hope and Healing. It's published by Harper One. It's available on Amazon and most books, paperback now.
That's terrific. Well, Dr. James Gordon, I thank you so much for being with us here at the Solutions Summit. And thank you so much for your great work as a solutionary.
Thank you. Thanks for inviting me, Eleanor. It's great to be with you.
That's wonderful. And I just got word that Representative Jim McGovern from the U.S. House is on his way over to join us at the Solutions Summit. So we'll be bringing him to you as soon as he steps into the room. Meanwhile, we're going to move on to our next session, which is about a low-cost way to improve our mental health and physical well-being. And the solutionary I'd like to bring to the stage now is Roland McCready, who is research director at the HeartMath Institute. HeartMath is a low-cost, effective technique to help people be calm even in stressful situations. So I would like to invite Roland McCready to the stage.
Hi, Eleanor. Great to be here with you.
Thank you. And, a lot of people are not familiar with HeartMath. Would you like to make a brief statement about what is HeartMath and about the work you do?
I'd be happy to, Eleanor. Thank you. Let me start that by saying that the American Institute of Stress found that 90% of visits to a healthcare professional, primary care physician, are due to stress-related disorders. It's because of stress. And what I think we need to understand is that stress is always an emotion. It's the feelings we have, anxiety, frustration, overwhelm, these types of emotions that we call stress. And stress is the primary driver of the activity in our body, in our nervous system. It affects the way our brain works and the way the heart and brain work together. And as Dr. Gordon just shared, what happens in our body affects the way we think and feel, and how we think and feel affects the activity in our body. That's what we research here in our laboratory. And we discovered back in the very early 90s that the most efficient way to understand how emotions are affecting the body is to look at the rhythms of the heart. It's I won't go into all the science here. And so all it's called stressful emotions that deplete our energy, that we tend to associate with stress, have profound physiological effects. They deplete our energy, and they lead to a state called cortical inhibition. We can't think clearly when we're stressed. So HeartMath is a system, a science-based system of practices, tools, techniques, technologies that are primarily enable people to understand their emotions and regulate their emotions, to become more aware of what we're feeling, our emotional state at any time throughout the day. So we're very focused on in the moment self-regulation. So as we become more aware of what we're actually feeling, but a lot of us are totally unaware of what's really happening in our body and our physiology. So we can acknowledge it, and then we have the power through simple techniques to make a choice, to choose the state, the emotional state that is best for whatever situation we might be in. Now, the key to this is being able to get the physiological systems in our body, what we call in sync or in a coherent state. And it kind of just makes common sense that if the activity in our brain and nervous system is scrambled out of sync, which it literally is, we can measure that to be able to bring our physiology into a more coherent state that underlies our ability to think clearly, to choose our emotions, is really the key to good health, being able to think clearly, make better decisions. Really anything in life we approach when we're in a more coherent state that we're going to be able to do much better at.
That sounds really interesting, and thank you for that explanation. Most people probably have not heard of heart math. And what you say makes sense about the physiology and becoming aware of your kind of emotional state and your physical state. And then consciously relaxing. What kind of evidence do you have that heart math actually works?
Well, good question, Eleanor. I'm glad you asked that. Well, currently there are around 500 independent research studies that have used heart math in a wide variety of contexts, everything from helping with chronic disease in schools and educations, students do better on tests, academic education, but more importantly, they learn how to get along with each other better, how to form more positive relationships, how to self-regulate. We do a lot of work, and there's published studies and all the things I'm talking about. I mean, hundreds. We do a lot of work in the military, in police, law enforcement, firefighting. And what we really are able to do there in those contexts is give these officers, these first responders, simple techniques they can use right in the moment that allows them to maintain their composure in the chaos that they're walking into, so that they can make better choices, better decisions. We also do a lot of work in athletics, for example, because when we get our physiology into what we call a coherent state, we perform better. So many Olympic teams have heart math trainers embedded in them, for example, professional sports teams. We do a lot of work in the VA. Right now, also the Army has adopted one of our technologies and trainings kind of force-wide. I've personally done a lot of work in the Navy as well, with the highest stress missions in the Navy. And we do much also in education. So there are multiple programs for schools and children, which I think is one of the most important things we can do, is to start educating our children about their emotions and how they can really manage stress and get along with each other better. It's one of the most important things we can be teaching youth, so we don't have to, I'll just say, beat ourselves up through the stresses of life and then unlearn all of that we learned later in life.
That's really great. I'm so happy to hear that you're using these tools, for the Army, for the Navy, for the Veterans Administration. So thank you for helping our military to kind of be as calm and healthy as we possibly can. You talk about heart math being used for both physical and mental health. How long does it take to reap the benefits of using the tools, and can you give some specific examples?
Oh, absolutely. That's one of the beauties of the heart math techniques, as I mentioned earlier, Eleanor. There's about 8 core techniques that we teach, and almost all of them are designed to be used in the moment. In other words, we're starting to trigger, to feel stressed, or we're walking into a situation where we want to be able to be our best. So that's really in that context that we focus. And you can learn a technique. We intentionally make them very simple so that they can be applied anywhere from kindergarten to literally generals and CEOs. Of course, the context is different, but the core techniques are the same across all of those broad ranges. You can learn a technique in just a few minutes and get instant benefit if you use them. And as we practice them over a few weeks, we literally train our physiology, our bodies, into a new state that we call our baseline. So that makes them much easier to use. And that's when this is truly transformational for people in their lives. So you can get instant benefit from these. So just in a few minutes of learning even a simple technique, you wouldn't believe how many letters and testimonials we get from people who just read about it in an article in a newspaper or a magazine. Of course, it's much better to go through a formal training and learn this, or go to take one of our online courses to really get the context. And the key for most people is remembering to use a technique, because when we get stressed, right, we feel frustrated or impatient, these types of feelings, we literally go into a state that was coined cortical inhibition back in the 1970s to describe how our physiology works. So when we get stressed, we forget we learned something, or that we know how to deal with something. So we also do a lot of work on what I call sustainability. Once you've learned these practices, these techniques, how do we help people overcome those neural patterns that are deeply ingrained from the past, to remember to use a technique in the moment to make those shifts until it becomes their new normal.
That's terrific. I love that it's so fast. It's just like it's that instant of awareness of thinking in the moment to consciously calm yourself down and put the technique to work. I'm concerned, as many of us are, about how widespread stress is in the United States right now, really around the world. And I'm wondering how you think is the best way that these HeartMath techniques could be used to improve our entire nation's health and rapidly.
Yeah, there's a lot of ways, and we have done some community demonstration projects in the past. Actually, to share the techniques with the public is really pretty easy, from my perspective. But again, I think we start with education and policy, the teaching this in our schools to our kids, teachers. We've done some large. Actually, been funded by the U.S. Department of Education for some of our larger studies in education. And teachers need to learn this as much as the kids, because they model us. But also there's things that we can do through public service announcements, there's so many ways we can reach people, through the companies they work in is one of the main ways, online programs and courses. So there's so many ways. And I think bringing people together is one of the best things. I liked a lot of what Dr. Gordon said. In fact, we'd almost mirror each other in what we would say. We also do a lot of work in trauma as well, and trauma-informed care, teaching, school counselors, for example, but healthcare workers. We have a trauma certification as well that could be used by almost anyone, anywhere, and it's in many languages as well. So I hope I've answered your question, but but anyway, we just have to get these tools in the hands of the people, because they're, as I said, they're intentionally simple, and then really help create support groups and things like this to discuss them, to discuss what our challenges were when we could have used a technique and didn't, these types of things.
Right. Well, I was excited to learn not only of you bringing these techniques into the military, but also to the police, who are often in highly stressful situations, and maybe just a little bit of de-stressing, help people breathe a little bit, might de-escalate some very dangerous situations. I'd like to, so I would say maybe we could bring this to all the police departments across the country. Why not? It's a low-cost, impactful way to de-stress. I'd like to bring into the conversation now Dr. Yvette Miller, and we've been talking a little bit about applications of HeartMath and how helpful it can be. Dr. Yvette Miller is Executive Medical Officer for the American Red Cross and a certified HeartMath trainer. So Dr. Miller, welcome to the Solution Summit.
Thank you so much, Eleanor, and for this invitation to the Solution Summit. And you and your team have absolutely been fantastic. So thank you for this opportunity.
I'm so happy you're with us. And, in your role as a physician leader with the American Red Cross, and you're a certified HeartMath trainer, how have you used HeartMath, or do you see HeartMath being used to help the Red Cross staff as they're enduring or recovering from trauma?
Well, again, thank you. I'm so glad that Roland is here. We were able to train back before during COVID. We got a grant and we were able to train some individuals, chief nurse and myself, as to some of the primary trainers. We have other people that are also trained in the heart math technique, but primarily heart math is used. It increases a person's capacity to be, emotionally calm, and it's a tool that also calms the heart rate, because the first thing that happens when something is stressful is that the fight or flight response kicks in and the heart rate increases, and as Roland has already mentioned, sort of get that cortical blindness. And so this technique increases a person's capacity to be calm even in the midst of chaos and trauma, again, as has already been mentioned by Dr. Gordon as well. Because when you're in that situation with all the physiologically active hormones, throughout the body, increasing the heart rate, changing the judgment, this tool gives one an opportunity to be what is described as actively calm, meaning that there's chaos, there's stress, everything that's occurring in the environment, but you're able to control your emotions and your heart rate and be present to be able to deal with whatever the chaos is and make clear decisions about how to deal with the situation at hand. And that's what we share with our staff at the American Red Cross.
That's fantastic. I'm sure you've got many instances where you want to help people be calm in the midst of chaos. And we know we think better, make better choices when we're more calm than when we're really stressed out. So I think we can all use it in some ways. But what is the evidence that you have that heart math is effective in your work?
Well, it's a very personal story. I started using heart math about 12 years ago as a personal self-care practice. And so and I've talked about it, literally with my colleagues, all over the world, both nationally, internationally, about the benefits, personal benefits of using heart math. And so this tool is important to me because, again, it's my personal practice, and it gives everyone the opportunity to use it first as a personal practice, but then also use it in our professional lives, particularly in situations where we're constantly under stress, regardless of what area we work in, but particularly in healthcare, which more often than not, even when it doesn't appear to be stressful, it's stressful because you have someone's life basically in your hands and you're making critical decisions, in many cases, at a moment's notice. And so this technique gives us the opportunity to be actively calm and make very quick and very informed decisions in a calm and active way.
That's wonderful. So we're going to move now to the question and answer segment of this session, and I'll invite back to the stage Dr. Susan Abu-Khair. And Dr. Abu-Khair, do you have a question on the heart math?
Sure. Just to start us off, thank you both. It's so inspiring because it's so accessible. It sounds like a tool and a series of practices that, all of us can learn and benefit from in our everyday lives, as well as in these high stress professions. My question to you both is really, what are the barriers to just rapidly disseminating these practices throughout the population at every level, kids, adults, professionals, police officers? What are the barriers to making this really a widespread practice for everyone?
Well, actually, I think it's barrier free. It's one, there are some techniques that are barrier free, but I mean, if in terms of barrier, I think the only real barrier is a person's resistance to learning it, or not having, the space or the capacity at the moment to be able to learn it. But I think it is one of the greatest barrier-free techniques for self-care. What are your thoughts, Roland?
Yeah, well,
I'm sorry to interrupt you, but our good friend Congressman Jim McGovern has just appeared. So hold this thought, hold this conversation. We will come back to you, but I just have to give a warm welcome to my good friend, Congressman McGovern.
Good to see you.
Great to see you. And why don't you have a seat and say a few words to our solution summoners?
Well, where are we at? Where are you at now? What are you?
Talking about how to be less stressful. I was thinking of you actually on the floor of the House January 6th and all the trauma here, but we've got a fellow who's the research director for HeartMath who's got a very simple technique help you become more aware of your emotional, physical well-being and kind of instantly help you relax and calm. They're using it in the military to help the soldiers. They're using it in police departments to kind of de-stress in tough situations. So we were talking about that. And earlier, a subject I know near and dear to your heart, food. We're talking about the importance of food and its connection to health and importance of having healthy food to have healthy bodies and having access to healthy food.
Well, obviously, I think all those things are incredibly important. And if it was ever a place that needed to de-stress and to take a deep breath and to reflect in a way where it's not always in your face, it is here in Congress. I mean, we seem incapable of having discussions. We seem incapable of being able to even try to understand, where somebody else is coming from who may have a different point of view.
Mm-hmm.
So, I think that, from a practical vantage point, techniques to help people be able to deal with everything better, I think are very, very important. We're having this, and we, by the way, not only in Congress, but all across the country, we have this debate going on now on, Israel and the Palestinians and Hamas. And one of the things that is really frustrating to me is that it doesn't seem that anybody's willing to listen to anybody else.
That's right.
And I don't know how we fix that, but that and so many other topics, you walk into a room and people have their opinion and are not open to listening, and then there's a lot of anger and polarization, which we need to figure out how to deal with. But I think a lot of the stuff that you've been talking about today are practical things that can be utilized here, and we need to figure out how to do things better. Politics is about human relations. And sometimes we forget that. We think it's a combat sport, right? I mean,
right.
It's about destroying somebody. No, it's about interacting with people, and it's about listening and learning, and it's about how we can build things together and make things better for everybody. And we've lost our way, and to get back on the right track, we got to figure out a way for people to deal with their anger and this polarization, which is so destructive. So in any event, but you've been doing that kind of stuff all your life, ever since I've known you. So I mean, it's like we're preaching to the choir, but sometimes it's good therapy to preach to the choir.
The choir needs
right. In any event, but anyway, we have an unexpected rules meeting. I've been in the meeting, so I just wanted to come out and just wish you the best and tell you how much I admire and respect you, and anything you ever need from me, I'm there.
Awesome.
All right.
So appreciate
Good to see you.
Yeah.
All right, Eleanor. All right. Thanks.
It's nice to know there's some sanity in the house.
Sure. If my wife were here, she'd disagree.
Thank you. Thanks, Bella. All right, wonderful. That's our host, Representative Jim McGovern, and we want to circle back now to the HeartMath conversation. If we could bring Roland, you were just about to answer the question on how do we know this works and evidence and experience. What are the obstacles and to this being more widely used? If you could unmute yourself, what are the obstacles to this being used more widely since it's so effective and so inexpensive?
Yeah, well, there really isn't a cost obstacle. As Dr. Miller said, a lot of the stuff we do is free. There is technology that greatly facilitates people learning these skills and training the physiology that could use funding. Policy, I think, is one of the barriers, certainly in education, that And there's some signs that's starting to change, but I think it really should be a core policy from the highest levels, that in education, it's not just about math and reading, but it's also about learning to social and emotional learning, as it's often called, but learning how to self-regulate, how to get along, as the congressman was just talking about. We've lost our way. And a lot of what we teach is we actually have a program called the Activating the Heart of Teens. That's really all about what we call social coherence. How do we get past our judgments and our extreme biases and learn to work together? So these are fundamental educational things. In law enforcement, fortunately, we are embedded in a nationwide program called Blue Courage. It's won major awards for helping law enforcement. That's many thousands of officers have been trained in this, but it's still just tip of the iceberg, right? So these kind of programs, they require funding. And they require policy to drive the funding, if you will, and make it part of the policy. So education, policing, law enforcement, these are all areas that could easily and quickly be improved. And if we could get these tools and techniques to the officers, but also to the public in public education programs that we make available through PBS, things like that. But again, it requires funding.
That's great. Yeah, maybe it's be like a public service announcement, right? Put it on television, like calm people down. We have a request from one of our participants here, inviting Roland, asking if you would lead a quick coherence. If you could do a brief coherence.
Sure, I could do that. And the quick coherence is one of our techniques, but I'm actually going to suggest we do something else. It's a technique similar. It's very similar, but it's called shift and lift. And because this is a technique that that I'm going to share with you that you can use anywhere, anytime. And the key is the other people don't even need to know you're doing it. And this is something that you would do it when you're interacting with someone else. And that's why I want to use this one rather than just a personal thing that could actually help with what the congressman was talking about. So here's the 3 steps. First step is called heart-focused breathing. So you focus your attention in the area of your heart, basically the center of your chest, and imagine that your breath is flowing in and out of your heart or chest area, breathing a little slower and deeper than usual. Just find a rhythm that's comfortable. So let's all just do that. Just pretend you're breathing through the area of your heart, a little slower and deeper. Do a couple breaths, about 5 seconds on the in breath, 5 seconds on the out breath. That's the natural rhythm, what's called the resonant frequency in between the heart, brain, and lungs. Now, as you continue the heart-focused breathing, the second step, so I want to consciously activate feelings of kindness. Just breathe that feeling of kindness, appreciation, a genuine connection, or an attitude of deep listening. We're intentionally start breathing that feeling, and that starts making a lot of shifts in our body and our physiology, that activation, when we add that to the breathing. And the third step, we want to send or radiate those heart qualities, those heart feelings, to raise your vibration and help lift the energy environment, the energy field that surrounds us. Now, that last part may sound a little new agey or something, but it's not. We literally have a magnetic field generated by the heart that we can measure with devices quite a few feet from the body. And we know that that field carries emotional information. So what we feel inside doesn't stop at the skin. We are literally radiating that. And it has measurable effects on others. One of the best things we can do to help de-escalate a conversation and have deeper listening is to shift our own physiology into that coherent state, and then actively activate feelings of appreciation, genuine connection, and deep listening.
That's great. Well, thank you for that demonstration. I appreciate that. We can all use that. I think I'm going to watch that recording daily. And I just want to invite Dr. Abu Khair to just say, as we wrap up this session on heart math, what would be your key takeaways from this session?
one of the things I'm really struck by, and thank you both again for your wonderful work. One of the things I'm really struck by is how in the most recent conversation with we talked about human relationships. We talked about listening to each other. We've talked about regulating our nervous system. In other words, we've talked about ways to really have an impact on ourselves and our world that are learnable, that are very accessible, and honestly, that are free to some extent. Once we learn these, once we invest in the education and the empowerment to people. And I'm just really struck, and certainly if you add food in there, by the, I'm going to put air quotes around the word simple, by the solutions that are simple. I don't mean that they're primarily uninteresting. I just mean that they're not overly fraught with expensive, R&D, and that these simple solutions are systematically, I think, undervalued in healthcare. I think one of the elephants in the room is how healthcare tends to undervalue things that are not super costly, are not procedural, are not genetic, are not pharmaceutical. And one of the things I think we really need to do, and what this summit is really pointing out, is to rebalance what we value and to really make sure that we don't systematically undervalue these things, but the reverse, by really putting our investment, our energy, our education into those kinds of solutions.
I appreciate the comment. I'm sorry, I just have to laugh because in the room next to us is the U.S. Marine Band. So I can only take it as a message that music is part of our healing, and we are patriots for bringing what needs to be brought into the U.S. Congress to make the changes that are needed. I want to say goodbye and thank you to Roland McCready for all your great work on HeartMath. Invite Dr. Miller to stay with us for come back at the next session, and also Dr. Abukar. I'll see you at the summary at the end.
Take care, everyone. Thank you.
I will simply invite Dr. Vernica Porter Sales to speak. She is the Chief Population Health and Legacy Performance Services Officer at a wonderful place called the Legacy Community Health Services, the largest federally qualified health center in the Southwest. So you're providing high quality health, wellness, social and educational services to patients, regardless of their ability to pay. We're here with you to talk about a model of community health care that you provide. Dr. Vernica Porter Sales, would you please come to the stage?
Hello there.
Hi there. Welcome to Solution Summit.
Thank you for having me.
Yes, so this is terrific. If you could please just make a few minutes opening remarks, talk about your work at the community health centers, and then we'll have a conversation about it.
Absolutely. So Legacy, as you stated, is the largest FQHC here in Texas. We have about 50 plus clinics serving over 200,000 patients a year. Most recently, we had 700,000 plus encounters serving this community, most of which I would say 20% of that was uncompensated charity care. And so we're providing that without the person's ability to pay. In addition, something that I've been brought to Legacy to do is to roll out the value-based care in a community setting. So I'm hopeful that we can, do this and provide what is quality health care to a very vulnerable population, and share more with you about it as we go along.
Terrific. Could you say what are the most frequent health issues that people come to your clinics with?
Right now, we're seeing a lot of obesity, diabetes, hypertension, and we are a large behavioral health provider. So anxiety and major depression is what we are encountering in the patients that we serve now.
Okay, great. And would you say how many of those illnesses are either created by or made worse by chronic stress and poor nutrition, as we've talked about?
Yes, all of them. If we want to be frank, there's an elevation of cortisol when stressed, and so that can lead to the insulin resistance that we see in diabetes. The pressures are increased in high blood pressure and hypertension, and we know that weight gain exacerbates all of those things. So the poor nutrition that our individuals are experiencing, we're located here in a large metropolitan location, but despite that, we still have poor selections, food deserts right in the major urban setting. And so we know for a fact that all of those, the stress, the poor nutrition impacts the health of those that we are trying to help better their own health outcomes, and something we work towards every day.
That's great. And what lessons have you learned about providing effective health care at the clinic level?
So for us, in trying to create a culture of caring, we've established a safe space where people can seek care without judgment or their ability to pay. In addition, we've learned that we need to include people in the decision making about their care and try to support them in making great decisions. So instead of being preachy around what we know are some of the barriers, we seek to provide those wraparound services. And being an FQHC, we are positioned to do that. We offer a social work team that helps with the social determinants or those non-medical drivers that patients may be experiencing. We support them in coordinating transportation. In addition, we have stood up a care management team that helps to educate them around their disease processes. We offer services like dietary services, nutrition. We even have a fitness program here at Legacy. And to expand on that, like I said, none of this could be made possible without the 100+ therapists and the 40+ psychiatrists that we employ. And so we're pretty proud of the integrated model that we've been able to establish here at Legacy to support the patients and on their journey to improving their health.
That's wonderful. And from your experience on the ground there, what would be the top recommendations you have for government leaders on how we could improve our nation's health?
So one of the things that is near and dear to me as a pediatrician is prioritizing the health education, beginning in elementary and all the way through high school. If I had my way, we would build it into the curriculum and make it so that we have sustainable, impactful health outcomes in our young children, which we know will influence their parents. And I think that is one of the ways that we can move the health of our nation forward. A second thing is I think we should develop policies that allow for universal access to quality health care and making prevention a priority. Today, we focus on sick care. We really do. We're reactive in the care that we provide, and we need to get ahead of that. And one of the ways I think we could accomplish that is by our government, our nation, paying for medical students to go to schools specifically to have them focus in primary care. And I think that would allow for us to support the growing populations, because that's something that we struggle with in our area, access to care. And we don't have enough providers to go around for the people that actually need that care. And then lastly, I think in understanding how intertwined the economics and health outcomes for individuals really is. You cannot expect someone to know and prioritize their health when they're struggling to understand how to navigate just life and the financial parts of that life. So maybe mandating and formalizing a financial literacy program into our school curriculum is also a way of which our nation can kind of have that sustainable, impactful programs that we're trying to see in patients' outcomes.
I never would have thought about financial literacy as an essential part of our improving our health, but you are so right. And it just shows part of the inner flow and how interconnected these issues are. I hope our participants can see the recording, we did a day on how do we expand prosperity, broaden the circle of prosperity, and bring economic security to all. So we address those issues there. I'd like to bring, please, Dr. Sales, stay with us. I'd like to bring Dr. Yvette Miller back to the stage. And, in addition to your work, the Red Cross, you're an expert in and a powerful proponent for addressing the systemic and structural racism in our healthcare system. So a question for Dr. Miller is, at its very essence, what is the impact of racism in healthcare, and what are your recommendations for how to dismantle and transform it?
So, what has certainly become part of the larger conversation in this country in general, but specifically in medicine over the last 4 or 5 years, or maybe even a little longer, is the fact of structural racism and bias in this country, and that it affects every system in this country, and specifically the healthcare system. The decisions that we make are affected by what we now have come to know and understand is implicit bias, which is bias that we learn from our families of origin and from our communities. And it's it's just how we transmit culture. And it's unintentionally, this implicit bias, colors the way we make decisions. It's unintentional judgment and that we use in making decision, and it affects how we deliver healthcare in this country. One example of this is in 2018. So there's a national healthcare quality and disparities report that comes out periodically. And in 2018, this report showed that Blacks, Native Americans, Asian Pacific Islanders, on some of the parameters that they were looking at, that 40%, in relationship to 40% of these quality measures, people from diverse communities and communities of color received poorer care compared to whites in relationship to these quality measures. And this has been going on for years. There was a report in 2003 which showed some of these same disparities, and they continue to exist in 2018 and certainly likely still exist today. So we have to be intentional about identifying and addressing health disparities and health inequities, and checking our own implicit bias, because we all have these biases that we learn from our community. So no one is exempt, and we all have to be honest and truthful about it. Be intentional and introspective about how it affects the decisions that we make, and this can certainly lead to the improvement of healthcare in this country.
Yeah, that's so true. And, this idea of course, as you say, awareness of the structural racism and biases, the first place, just like become aware that it's there. And once we know that it's there, this is a problem. Like it's wide, it's deep. What are some of the specific actions you would recommend we take in order to dismantle and transform racism in our healthcare system?
Well, again, some of the first work that we have to do is personal, is understanding that, this is not a place where we're blaming or shaming each other about, our points of view. That's just the way that, culture is transmitted, but we have to be honest about how it affects the decisions that we make every day in our lives, and specifically in relationship to our healthcare decisions. So the first thing that I'm going to just ask people to do is just have an open heart and an open mind about how we move forward collectively as a nation toward improving healthcare. And Dr. Sales has already mentioned the social determinants of health. Even if we could, quote unquote, fix healthcare, those other social determinants of health, those things that don't appear to affect health, they absolutely do. As she mentioned, finances, the education system. We must address all of those issues as well in order for communities to be truly healthy. So some of the things I suggest, again, is just acknowledge the structural nature of structural racism and bias, and that this structural racism and bias has historically created systems of inequity. And that is the result of the long-standing history of segregation in this country. That's the legacy of segregation in this country, is health inequities and health disparities. So that's the first thing, is just be open and intentional about wanting to do this work and correct the systems. And then secondly, and this has been mentioned numerous times already, including by Dr. Sales, is we must transform medical education and residency to clearly define and address, the structural racism and bias and implicit bias in the system, and how they affect our ability to make decisions around healthcare, but also in relationship to the social determinants of health. And then two of the other things that I think are important is to implement core competencies. And we have talked about this as well. For us to be held to the same standard of what we're trying to accomplish, there has to be core competencies that we all believe are necessary for us to accomplish in order to prepare healthcare providers. And we've already talked about, and Dr. Sales, again, we are totally in synchronicity around this, is all healthcare providers. She talked about how interprofessional her team of healthcare providers are. So this is not just physicians and nurses. These are physical therapists. These are acupuncturists. Anyone that you bring into your circle as those folks that can share the information about self-care and heart math and those other kind of modalities. So everyone has to be on the same page and understand, for us to be successful, we have to accomplish these core competencies. And then the last thing is to identify strategies to diversify the pool of healthcare providers. There is absolutely research that shows that patients from diverse communities and communities of color get greater satisfaction in terms of their healthcare when they interact with providers that they are comfortable with and that are from their communities. So there's things those are just 4 simple points that if we could coalesce around just those simple things and have core competencies and understand where we've been and where we want to go, we can absolutely have an impact on improving access to health care so that all communities can be as healthy as they can.
That's wonderful, Dr. Miller. I'm so encouraged by what you're saying, because when I think about dismantling racism in the healthcare system, it's kind of overwhelming. But when you lay it out step by step, I go, we can do that. We can do that. It's all eminently doable. So that's very encouraging. I appreciate your clarity and specificity on what we need to do. We're moving into our question and answer segment. I invite Dr. Susan Abu-Khair to join us back on the stage. And as you're coming on, we already have a question in from Tracy, and that is for Dr. Sales. And the question is, what distinguishes the quality of your services and the diversity of your service, and how do you deliver greater care and healing?
So that's a great question. So because of us being a federally qualified health clinic, we have hired and intentionally hired providers that look like the population we serve. So we are cognizant about the language. So that brings a higher level of care to this group. We make them feel comfortable. Legacy started out providing care during the HIV/AIDS epidemic. And so hiring staff that have lived that experience also helps them to be more empathetic and understand some of the challenges that our patients are facing as they come through. And so in that, we hope and pray that we are delivering that higher quality of care, because the patient views it as high quality, right? It's not what we necessarily say that is. It is how they experience it in the patient satisfaction that is gained. The other thing that I failed to share that Legacy offers, and which is a great benefit to the patients that we serve, is the 340B pharmacy that we offer. So we and all of the other comprehensive services, we actually have the pharmacy services that can help provide that treatment that's needed, that's ordered by the clinician for that patient. And we do that in an affordable way. So when I add all the things, the wraparound services, the dental, the vision that we provide too, it just provides a more holistic approach to the needs that a person would need in one setting. So I hope that answers the question.
It really does. And, the more I learn, the more this wraparound services matter. We've got an experience here at Union Station in Washington, D.C., right down the street, where this homeless population kind of camping out at Union Station. And some woman has come and she's like helping people get housing, get medical care, then get a job. And it's been enormously successful because she's trying to help with everything that they need at once. And it's been so successful. A fellow at Amtrak is saying, hey, I want this approach taken at every Amtrak station around the country. So I think wraparound services is a good model. Dr. Abu Khair, how is this sounding to you? Do you have any question or comment?
I do. I have a question for Dr. Porter Sales, which is this. From my understanding, it seemed that your organization, your FQHC, partnered with CareSource, the organization that administers Medicaid in your area. And I'm really curious, how important was the partnership between the payers and the provider organizations to the success of your work? Can you talk a little bit about that partnership? And is there a message there that might be a blueprint for how we move forward, aligning the payers and the providers?
Yes, it was definitely an intentional partnership. CareSource brings their expertise in administering the Medicaid benefit throughout the country. And then Legacy brings that provider perspective to that underserved population that we are technically bidding on, which is the TANF population. So we are well versed in treating those populations. We deliver the largest number of care for the largest number of pregnant women in the state of Texas. And so we know that women and children are imperative to that bid. But what we thought we would bring would be a conversation with a large number of providers to the table with a payer that would actually be willing to listen. So the CareSource is non-for-profit, and as are we. And so we have an aligned mission, and we're not really beholden to stakeholders. Our stakeholders are the members that we would serve and administering that benefit. And so that was our strategy. We bid on the Harris service area and the Jefferson service area, which is where Legacy practices, and I have practiced in Beaumont and in Houston area. And so we felt like we knew this community intimately and the needs, and we could provide the benefit, the medical benefit, in a way that no one else could do. And so that is what we're really striving to do. We have not yet received the bid, but the answer to the bid, but we're hoping and we're keeping our fingers crossed that we will come out on top and be successful and show the state how it could be done and be the blueprint going forward.
I'm so struck by your statement, part of your statement, where you said we're not beholden to the stakeholders. And of course, we in healthcare are beholden to our patients. That ought to be to whom we are beholden. And I just wonder if you have any words of wisdom about the, sort of huge issue of how payment and the alignment of payment and reward and incentive influences all the things that we're talking about, and how we continue to step in the direction of being beholden directly to our patients.
Yeah. And so having been on the managed care side for about 12 years, I tried to be that voice and the champion for the physicians and really say, we need to incentivize the actions that we really want to happen. And it's still in that fee for service world as we try to roll out value-based care. It's very challenging because the private primary care or the private practice, they're not incentivized to see and talk. I think that was mentioned earlier in the segment. It's really about talking and influencing the behaviors and building a relationship with the patient that takes the time. And that's not the incentive. The incentive has been volume. And as we try to make this shift to value, how valuable am I being to this patient that is before me as I try to change the trajectory of a community, it needs to be brought or compensated by the payers, and they need to hear us. But I know that, they want that. We've had some conversations, but the actions don't match what the desire really is. And so for me, I hope that in this CareSource legacy partnership, that we can actually make that change that we're trying to be, or we want to see. And so we'll see. We'll stay tuned. More to come.
And so,
That's
Dr.
great.
Abukar, can I just add that, again, just along those same lines as Dr. Sells, it's part of healing is the therapeutic relationship between the client or patient and the provider. And that cannot be underestimated, and it's certainly not, part of the compensation model, but that therapeutic relationship has such a tremendous impact on partnering with the patient to understand what is important to the patient in terms of what they want to accomplish for their health, not what the healthcare provider wants to deliver to them.
That's great. Well, that concludes this segment. I invite Dr. Abukar to stay on, and Doctors Miller and Sales, thank you so much for your wisdom and your good work. I hope we're in touch again soon.
Thank you so much. It's a great opportunity.
So, Dr. Abukar, could you start us off with a summary of what do you think the key points of the day are from this whole program on health?
Wow, what an amazing array of solutions. It's so inspiring, and it really inspires confidence and optimism, because so many of these solutions are ones that can be implemented today, now, across the board. Nowhere did we hear the desire for, a magic pill, a miracle cure, a pharmaceutical solution to everything that ails us. What we're hearing, and which is so profoundly important, we're hearing solutions that are systems-based solutions that are rooted in our social environments. They're rooted in our daily lives and how we interact with each other, how we learn to take care of our bodies, how we learn to take care of our nervous systems, how we interact with each other. So these solutions are systems-based. And as we know, it hasn't really been stated, but it's sort of an obvious part of healthcare, is that a lot of the training and rewards in healthcare have been pinpoint solutions, have been reducing the problem, down to its enzyme or its, antibody, and offering pinpoint solutions. Some of those are incredibly powerful and have a major impact on disease and cancer, but they're not really system solutions. So one of the really overarching messages here is that healthcare, as we look at healthcare broadly, we want to shift our focus to the systems of care, to the relationships between things, between each other, between food and health, between trauma and our daily wellness practices, between our relationships with each other, and has been stated between providers and patients, those relationships and the time it takes to talk to people, to learn their culture, to address their social context, and then to align, which is probably, topic of another summit, but to really align the payment structures that we have to reward those conversations, those relationships, those educational things, instead of the RVU based rapid fire, here's my problem, here's your prescription kind of medicine. I talk to residents and medical students regularly, and I just want to share that I hear so much hope. I talk to them about their values and what brought them into medicine. And, without fail, people share, I decided to go into medicine because of the joy of human connection. I love hearing people's stories. I love really feeling of value to people. And, what they're not saying is, I want to get in and out of there in 9 minutes and have a prescription written before I'm done. So the joy is there to be tapped into. The solutions that are described today are available. I'm really impressed by the amazing accessibility of these solutions and how we should be so optimistic. And lastly, I just want to say before I pause here is there's a real shift toward public health as a means of as a lens through which we should all be looking at healthcare, not only people in public health, so to speak, but for every physician and provider being trained, rather than continue our training as one-to-one medicine. I have a patient in front of me. What's the problem? What's the differential? But all of us being trained in the public health solutions, such as clean air and healthy food and healthy relationships, so that we can bring that to bear with every provider in the treatments that they offer. So really need to have a shift where we bring public health education into medical education on a regular basis. Let me just pause there. I'm eager to see what questions are coming up.
Yeah, that's great. I did have a question for you. I noticed in several instances today, people talked about the need to change education for doctors, that we want more training about the connection between food and health for the medical students. And then when we got to the how do we transform race, talking about educating about racial bias and structural racism as medical students and training the health professionals. You are a professor at the lead medical institution in the country, maybe the world, Harvard Medical School. What's your sense of what are the prospects of getting medical education to focus on more on food as health and more on these kinds of issues that we're talking about?
I think it's a bit complex. On the one hand, I think the prospects are excellent. I think the leaders in medical education that I interact with are very aware of the need to address healthcare needs in the context of the patient. In addition to the dazzling genomics and pharmaceutical things that are dazzling, in addition to that, I see a lot of awareness and commitment to teaching and incorporating into medical education, certainly the social determinants of health, implicit bias, structural racism. Perhaps we, still have a lot of awareness to go on nutrition and the impact of healthy food and the harm of unhealthy food. I do see a readiness and a receptivity to incorporating that into medical education. I think one of the complexities that I want to just point out is that it's not really sufficient to train someone to say know about things, so say how healthy diet impacts health, if when that person goes out to practice medicine, they're confronted with a system of rewards and incentives that smashes their ability to take the time to do that with their patients. So it needs to be medical education reform. It absolutely needs to happen and continue to happen. And the respect for the research and of the benefits of many of the things we've talked about today needs to be supported and enhanced, so that when we talk about evidence-based medicine, we're not only talking about pharmaceutically funded studies of drugs. We're also talking about the evidence here. But I also just think that education reform has to go hand in hand with payment reform, so that when the physicians are graduating from medical school and their residency training and entering practice, they're not entering a system that doesn't give them the time or the benefits or the financial opportunity to practice what they've learned. So I'll just pause there again.
That's great. And we just have like 1 minute left, but for this summary section, I'm so curious, if you were advising our leaders in government, what are the top 1, 2, or 3 actions you think that our government leaders should be taking to help our country be more healthy?
Well, one would be to rebalance the entire payment structure so that we're rewarding the primary care specialties of primary care, internal medicine, and family practice, and less so the procedural and high technology solutions. So if by rebalancing the payment structure, right now it's upside down. People who touch patients directly, who know the most broad amount of medicine, who are in a position to talk about food and nutrition and nervous system regulation are paid the least. And the people who do 7,000, catheterizations a year are paid the most. So not to disparage any of that, but I think number one is to rebalance the payment structure so that we have the foundation of a payment structure, and people in direct care with patients are, we can attract the best and the brightest to those fields, but also that when they get there, they have time to spend time with their patients, as was said by Dr. Miller and others, to form those relationships and really be in a position to advance some of the solutions that were brought about today. So that's one. The second is that we need to take, what I call a systems approach to healthcare. And what I mean by that is that despite the sort of obviousness in some ways of how complex and interrelated so many of our issues are, we still teach and practice in a siloed world, and we teach medicine, even the organ systems is siloed, as if, cardiology doesn't affect the lungs. I mean, we continue to deconstruct and silo things. So in order, what I like to say is that systems problems require system solutions, not pinpoint solutions. So the system solutions are those that really look at the interaction between provider behavior and payment structures, between social constructs of health and medical education, and really embrace in a very dramatic way a systems approach to healthcare, both in the way we teach, in the way we practice, in the way we pay, in the way we educate, and take that on so that we can really blow the walls out of this idea, like blow open the idea of what we call integrative health and complementary health, and not have that mean that people have to go out of their way individually to get some complementary health, but it doesn't interact with their, conventional medicine, but really rather support through policy, subsidies, education, payment, a truly holistic way of approaching all of the healthcare challenges we face.
That's an exciting vision, and I think we'll leave it there. And Dr. Susan Abu-Khair, Harvard Medical School, thank you so much for your great insights and all your solutions for health. I'm just going to mention a couple of things before we close. Our next event, and we're being brought out with the Marine Band, a rousing conclusion to the Solution Summit today. Our next event is Strengthening Our Democracy, which is on Thursday, November 16th from 12 to 2:30 p.m. Eastern. We will be having a live watch party at the Women's National Democratic Club in Washington, D.C. You're welcome to join us. Tell your friends about it. We'll send you a notice about that after this summit is over here. We will have a report that I'm writing from all four of these summits together, hopefully to be a guide to the issues for voters, for candidates, and for our leaders in government, and hopefully videos available after the summit. We'll let you know when they're ready, so look for an announcement from us. I would like to give a shout out to Clear Light and the good work that they do on health, and a thank you to the Solution Summit team. And we've got 3 members right here at the U.S. House. I'm going to invite you to come on up and stand with me. Oh, I see some shy people here, but I want to thank Tracy Gary is here in Washington, D.C. with us. Thank you so much, Tracy. Macy, come on up, and Macy Leiper, and here's Tracy. You can see us there.
Yeah, we're so happy to and so honored to be here with you. And what a great job you and the team have done. Thank you.
Thank you for all your great support and work. And Judith Kolowski, our on-site manager here at the house. Thank you also to Gayatri Bala, Janae Wallach, Maggie Lou, and Brad Perkins of Better Planet Media, Lila Bala Ladd, Pat Ewing, and Sarah McGovern. Thanks again to Representative Jim McGovern and his wonderful staff person, Bella Ito. We so appreciated his visit today and his hosting. A thank you to all our speakers, all our donors and sponsors, and to all of you listening. Thank you for being part of the solution as we build a solutions movement to create a better America and a better world. Thank you very much. Bye for now.